Oke, bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Hello, my name is Fahmi Ramadhan. I am is the sixth semester of English education of Uninus, and now I want to present about the anemia disease. And this presentation is to fulfill one of assignment given with Miss Paulina Novarita as lecturer of material English for medic. Okay, let's start our presentations by reciting first Al-Basmalah. Bismillahirrahmanirrahim. Okay, anemia disease. The definition: anemia disease, lack of blood or anemia is a condition when the body lacks healthy red blood cells or when the red blood cells don't function properly. As a result, the body's organs do not get enough oxygen, which makes anemia sufferers pale and tired easily. And anemia can be temporary or long-term, with severity ranging from mild to severe. Anemia is a blood disorder or hematological disorder that occurs when the hemoglobin level, the main part of red blood cells that binds oxygen, is below normal. Uh, Adults are said to suffer from anemia when the hemoglobin level is below 14 grams per deciliter for men and below 12 grams per deciliter for women. If the hemoglobin level is below 8 grams per deciliter, anemia is classified as severe and is called anemia gravis. To trust anemia depends on the underlying cause, from consuming iron supplement, blood transfusion to surgery. Nah, this is the anemia symptoms. Yeah, anemia sufferers can experience symptoms such as the first is limb and tired quickly. Yeah, this is the first symptoms. So the second is headache and dizziness. So the third is often drowsiness. For example, drowsiness after eating. That is. So the next is the skin looks pale or yellowish. So the next is irregular heartbeat. The next is shortness of breath, chest pain. So and the last, cold in the hands and feet. Nah, and then if you got the anemia symptoms, the first step is if you feel tired or experience symptoms of anemia that get worse over time, see your doctor. So the second is talk to your doctor if you have a condition that can cause anemia, such as kidney disease, menstrual disorder, colon cancer, or hemorrhoids. And last is if you suffer from a genetic disorder that causes anemia, such as thalassemia, or have a family suffering from the disease, it is feasible to consult with your doctor before planning to have children. So, which specialist medical you should be referred for? Of course, the medical personnel who usually carry out this examination are internal medicine doctors, or we can call internists, who specialize in hematology, or also called hematologists. You can recognize it from his title SP or PGKHOM, or or we can call consultant hematology medical oncology. A hematologist focuses on the branch of science related to blood component and their problems. This is the kind of medicine or medical process you should be done if you get the anemia symptoms. The anemia treatment, some example of anemia treatment or blood deficiency drug by type R. For the first treatment is anemia due to iron deficiency. Due to iron deficiency anemia, iron deficiency is one type of anemia that is very common in many people. This condition especially occurs in women who experience heavy menstruation. Iron deficiency anemia is caused by lack of iron in the body. So the body is unable to produce enough red blood cells. Uh, that is why increasing iron intake is one of the treatment options for treating anemia. You can get additional from iron from food or supplement. Some food that are high in iron include such like red meat, egg yolk, seafood, wheat, nuts, and not only that, eating chocolate can also be a fun way to deal with anemia, as well as simple anemia prevention. Both regular and dark chocolate are high in iron. So the second is anemia during pregnancy. This condition is treated by giving supplement of iron, vitamin B12, and folic acid. The dosage is determined by doctor. So the next is anemia due to bleeding. This condition is treated by stopping bleeding. If needed, the doctor will also provide iron supplement or blood transfusions. And the next is aplastic anemia. Treatment is with blood transfusion to increase the number of red blood cells or bone marrow transplants graft when the patient's bone marrow can no longer produce healthy red blood cells. So the next is hemolytic anemia. Treatment involves stopping drugs that trigger hemolytic anemia, treating infection, taking immunosuppressant drugs, or removing the spleen. So the next is anemia due to chronic disease. This condition is treated by treating the underlying disease. In certain conditions, blood transfusion and injection of the hormone erythropoietin are needed to increase the production of red blood cell. And the next is sickle cell anemia. This condition is treated with iron and folic acid supplement, bone marrow grafts, and administration of, chemotherapy, such as hydroxyurea under certain chemotherapy, such as hydroxyurea. Under certain conditions, the doctor will provide pain relievers and antibiotics. So the last is thalassemia. In treating thalassemia, doctors can perform blood transfusions, administration of folic acid supplements, removal of the spleen, and the bone marrow grafts. Okay, the next is what you should do to protect yourself from being reinfected. Anemia prevention is sometimes of anemia, such as anemia during pregnancy and anemia due to iron deficiency can be prevented by eating a diet rich in nutrients, especially food rich in iron and folic acid, such as meat, cereal, nut, dark green leafy vegetable, beans, and fruits. Food rich in vitamin B12, such as milk and its derivatives, as well as soy-based foods, such as tempeh and tofu. Fruit rich in vitamin C, such as orange, melons, tomatoes, and strawberries to find out whether your nutritional intake is sufficient. Consult nutrition specialist. If you have a family with anemia due to genetic disorders such as sickle cell anemia or thalassemia, consult your doctor before planning a pregnancy so that this condition does not occur in children. Okay, that from me. Forgive me from all my mistake. And the last, see you. Wassalamualaikum warahmatullahi wabarakatuh.